way. So this is an upright version of trying to kind of channel things through. So we can think about that chain of like, here where you can see me better maybe. Okay, so if I'm bending, flexing, I want to channel, maybe I'm getting pain in my sciatic or my hamstring areas tight. I want to try to pull in and turn that, tuck that pelvis. And then also here you want to think about maybe tucking the tailbone as well. So it's like a full pelvic tilt on both sides, even though I may be focusing more on the one, to get the sacrum to move and stretch and open that mid-low back, as well as turning the pelvis to engage the core, and then trying not to slouch and collapse up here like I'm doing right now at the moment. I want to try to keep the chest lifted, ribs anchored so the core is fully engaged like that tree hug, and then maybe the arm can come up here too. So I have a couple options for that to help that along, and maybe even make sure I'm not stressing, straining my neck or my shoulder too much. So I can either have a stick between my two hands here, so I can lift both hands up, or I can angle it and do just help the other one up as I do this. If I can balance that, that's the other thing with the two arms. You could do this, some version of this in sitting as well. Or I can do the opposite arm as I flex there to get some slack from the opposite side. So the different myofascial chains, directions of connection there. Another thing, way to work in this, preferably a staircase or something at the bottom on the first step with some rails or something, especially if you have balance issues. I'm gonna put one foot up here. So I'm just kind of doing this kind of loading, lunging, pulling back into my pelvis, kind of steering all that back there, grounding, pulling on the inner thigh to steady, stabilize, okay? And then I'm kind of like hinging like that drinking bird or woodpecker kind of position here to feed into that glute and hinge that hip, keeping my back nice straight, my chest up, ribs anchored back, tucking that core and pulling that stomach. But then I can also feed up here. So I maybe have this hand on a rail and this hand going like this, or even this hand on the rail and the opposite. So it might feel a bit different because of those factors of the other thing. If your balance is good enough, you could do like I did with the other ones and do here, or here, or here, or same thing in like a squat. If you're doing bilateral, this one, or again, here, or here, right? 3 options for that. So some different ways to kind of flex, but you're really trying to kind of isolate, target that core and try to get more flexion into the lumbar spine, especially if you have preference to that where it's maybe painful when you hyperextend, or maybe you just lose your balance that way too. Pull in, anchor, tuck that, not to flex your spine there, but to bring it maybe more to neutral and then extend more from that upper back. Lastly, what we can do here is maybe lean on a table, either in stride or wide stance, and to maybe even use the leverage of the table to try to drop the hips and kind of lift the upper chest and maybe rock through there too. So I'm pulling in, rounding out my low back and extending my upper back to find more neutral. I know it looks straight there, but I assure you it's not. There is a subtle S-curve there. It's just hard to see. But it's pretty hard to completely straighten out your spine unless you have a natural tendency to do that, or hypermobility in the sense of like being more of a mobile kind of person, which I am not. We can try that on different sides, see how maybe that feels different, or how maybe we can channel through some tightness and stretch some things out that way and try to loosen things up so there's less pain. I can add a rotational component as I swivel into that hip and maybe drop my opposite hip, which ties in with some of the squatting things as well. So there's a lot you can do. Arm, as long as it's not painful in the shoulder, neck, or anywhere else too much, just more of a stretch and try to work some things out. You might find some patterns and work out some kinks that way, or figure out strategies to work out some kinks. So there's a lot of things you can do, and if you're currently a patient, things we can do to figure all that out.